you know that nearly 1 in 3 people will be diagnosed with cancer at some point in their lives? That's a startling reality, isn't it? We're not talking about a rare exotic disease that you'd only catch if you ventured into uncharted territories. We're discussing a condition that has seeped into the very fabrics of our daily lives, affecting millions worldwide every single year. Cancer, a term that sends chills down our spines, is becoming alarmingly common. Our homes, our workplaces, our social circles, there's hardly a place untouched by its shadow. And it's not just the individual who suffers. Families, friends, entire communities can be impacted. Our journey today is about understanding this complex disease better. It's about acknowledging the elephant in the room and not just brushing it under the carpet. Because, my friends, understanding cancer, its causes and prevention, is not just for the affected, but for everyone. So, what exactly is cancer? It's not as straightforward as you might think. To understand cancer, we need to delve into the microscopic world of our cells. Our bodies are composed of trillions of cells, each carrying out specific tasks. These cells grow, divide, and die in a regulated manner to keep our bodies functioning optimally. Now, imagine a cell that's gone rogue. It starts to grow and divide uncontrollably, disregarding the body's usual checks and balances. This is the birth of a cancer cell. Unlike normal cells that have a specific lifespan, these cancer cells evade the natural process of cell death, becoming virtually immortal. As these cancer cells multiply, they amass, forming a lump known as a tumor. Not all tumors, however, are cancerous. We categorize them into 2 main types, benign and malignant. Benign tumors are non-cancerous. They grow slowly and do not spread to other parts of the body. On the flip side, malignant tumors are cancerous. They invade surrounding tissues and can spread throughout the body, a process known as metastasis. But here's where the intricacy of cancer truly comes to light. Not all cancers form tumors. For example, leukemias, a type of blood cancer, involve abnormal cell growth in the blood itself and do not form solid tumors. Furthermore, cancer is not just one disease. There are over 200 different types of cancer, each with its unique characteristics. They can originate from virtually any type of cell in the body, from the skin to the lungs, from the breast to the brain. And each of these cancers behaves differently. They grow at different rates, respond differently to treatments, and have different prognoses. That's why a treatment that works for one type of cancer may not work for another. It's like trying to solve hundreds of different puzzles, each with its own unique solution. Cancer is a complex disease with many variations and forms. As we continue to unravel its mysteries, we draw closer to finding more effective ways to prevent, diagnose, and treat this pervasive disease. Many of us wonder, what causes this life-threatening disease? The answer, unfortunately, is not as simple as one might hope. There's no single cause for cancer. Rather, it's the result of a complex interplay of various factors that can be broadly categorized into genetic factors, lifestyle choices, and environmental influences. Let's start with genetic factors. Each one of us carries a unique blueprint within our cells, our DNA, and sometimes this blueprint can go awry. These genetic changes can be inherited from our parents, or can occur spontaneously due to errors in DNA replication. Certain genes, known as oncogenes and tumor suppressor genes, when mutated, can lead to uncontrolled cell growth, which is the hallmark of cancer. Next up, lifestyle choices. We've all heard the saying, "You are what you eat." And when it comes to cancer, this couldn't be truer. A diet high in processed foods and low in fruits and vegetables can increase the risk of certain types of cancer. Similarly, smoking and excessive alcohol consumption are well-known culprits, contributing significantly to lung and oral cancers, among others. And let's not forget about environmental influences. Exposure to certain harmful substances, such as asbestos or certain types of radiation, can damage our DNA, leading to cancer. Even prolonged exposure to the sun can result in skin cancer due to the harmful ultraviolet rays. But here's the silver lining. While we can't control our genetic makeup, we certainly have a say in our lifestyle choices and environmental exposures. By eating a balanced diet, avoiding tobacco and excessive alcohol, and protecting ourselves from harmful substances and sun exposure, we can significantly reduce our risk of developing this disease. So it's not all doom and gloom. Yes, cancer is a complex and formidable foe, but understanding its causes empowers us to make informed decisions about our health. While some causes are out of our control, many are preventable through informed choices. Why is cancer so hard to treat? This is a question that has puzzled medical professionals for decades. Cancer is difficult to treat because of its complex nature. It's a disease that has a unique ability to spread and infiltrate healthy cells. This process, known as metastasis, is one of the primary reasons why cancer treatment is challenging. Furthermore, cancer cells can develop resistance to treatment strategies. This means that even with the most advanced therapies, cancer can adapt and continue to grow. This resistance can be due to genetic changes within the cancer cells or the cancer's ability to repair the damage caused by treatments. Moreover, cancer treatments often have a significant impact on a patient's overall health. They can cause severe side effects, such as fatigue, pain, and nausea, which can affect a patient's quality of life and their ability to tolerate treatment. This is why early detection and prevention are so crucial. Knowledge is power, especially when it comes to cancer. In the battle against this formidable adversary, our strongest weapon is awareness. It's essential to understand that early detection can significantly enhance the chances of successful treatment. Regular screenings, such as mammograms, colonoscopies, and skin checks, are vital tools in catching cancer in its earliest stages, when it's most manageable. Living a healthy lifestyle also plays a crucial role in cancer prevention. Incorporating balanced nutrition, regular exercise, and avoidance of harmful habits like smoking and excessive alcohol can reduce the risk of many types of cancer. But awareness doesn't stop with ourselves. It's our responsibility to spread this knowledge, to encourage our communities to take these preventative measures, to dispel myths and misconceptions. The conversation about cancer needs to be ongoing, open, and honest. Share this video with your loved ones because the fight against cancer begins with awareness. Let's empower each other with knowledge because together we can make a difference.